Hi guys, welcome to our thorax anatomy as we continue with our playlist. So today we are gonna take a look on a muscle separately called the diaphragm. The reason why I separated this muscle because it is a very important muscle, and it has to be respected. So a diaphragm, it is a muscle that separates two cavities. It separates the thoracic cavity, and the thoracic cavity, remember, embryologically it will start to be having the pericardial cavity connected to the pleural cavity, and later the pleuropericardial uh, membrane they membranes that will divide the pericardial cavity to um, from the pleural cavity, right? But remember, you'll be having the pleural cavity being connected to the peritoneal cavity via the peritoneal canals, and then the pleuroperitoneal membranes or folds that will meet ventrally with the with the mesentery of the with the esophagus, as well as the septum transversum, which are also structures that will form the diaphragm, and then also with the myoblast coming from C5 to C3 to C5, they will also form the diaphragm. So they would separate the thoracic cavity, which is now mainly the pleural cavity, and from the peritoneal cavity. So as you can see, it is a dome-shaped muscle, and it acts as two compartments. So you have a hemidiaphragm, a left hemidiaphragm, and a right hemidiaphragm. So this will be your left hemidiaphragm, and then this is your left hemidiaphragm. So since it is dome shaped, you're going to find that it is convex within there towards the thorax, and concave towards the abdomen. Right. So what are the mm, origin of this muscle? So the diaphragm, it covers or closes the inferior thoracic aperture, right? And it's going to have three origins. It's going to have a vertebral part, xiphoid process part, and a costal part. So let's start anteriorly. So you're going to have a xipisternal part. So posterior to the xipisternal, posterior to the xiphoid process, you're going to have an origin of the diaphragm. And then costally, you're going to have the diaphragm originating from lower 6 costal cartilages and ribs. In the vertebrae, the diaphragm is going to attach to the vertebrae via muscular bands that are referred to as screws. So you're going to have a right cruise and a longer cruise, and the left cruise. The right, which is the longest, is going to originate from the first three lumbar vertebrae. So lumbar number 1, 2, and 3, that's where the right cruise originates. While the left will originate only from the second and first lumbar vertebrae. So the right cruise now, it's, as you can see, it will move, it is to the right, but it will move towards the left, where it forms what you call the esophageal hiatus. So that is a point where the esophagus is going to leave the thoracic wall and change its name from being a thoracic esophagus to an abdominal esophagus once it passes through this hiatus made by the right cruise of the diaphragm. And then it is also going to have what we call arcuate ligaments. You're going to have 5 arcuate ligaments, namely between your crura, this is right and this is left. You're going to have a ligament that will attach the two. This is called a median arcuate ligament. So the right crura, the median arcuate ligament, and the left crura, they will form what we call an aortic hiatus. That's where your aorta will pass getting into the abdomen. Right. And then we're going to have a medial crura, a medial arcuate ligament and a lateral arcuate ligament. So the reason why there are 5, you only have 1 median, 2 medial, and 2 lateral. So this will be medial. So the medial is going to start from the lateral body of the second thoracic vertebrae and then attaches to the tip, and it attach to the tip, right? You can see this one, this is your medial. It attaches to the tip of the transverse process of A1, right? So this will be medial. And the rest for the lateral arcuate ligament is going to be, it's going to start or attach from the tip of the L1 lumbar vertebrae and then attach to the last rib, which is rib number 12. Right, so that will be your lateral arcuate ligament. Right. So the diaphragm is a dome shaped, and it is going to have a right dome and a left dome. Take note of this. The right dome is higher than the left dome. The reason why the right dome is higher than the left dome is because you see this whitish layer, you see this whitish point, that is called the tendinous arc. That is called a central tendon. So this central tendon now, you're going to discover that below it you're going to have a lever here. So the lever will be situated here. So remember, the right dome of the lever is bigger than the left lobe of the lever. Right lobe of the lever is bigger than the left lobe of the lever. So making the right dome of the diaphragm to be higher than the left dome. So the right dome is higher up to the 5th upper rib, while the left dome is lower and it goes up to the lower border of the 5th rib. Right upper border of the 5th rib, left lower border of the 5th rib. Right. So that's why we say any penetrations below or within the 4th intercostal space may more likely to affect your diaphragm, right? Because that's where your diaphragm will be ending, right? So where does your diaphragm insert? So the diaphragm, it will insert into this central tendon. It is a 3-leaf like structure, 3-leaf like tendinous structure. That is your insertion of the diaphragm. What is the action of the diaphragm? The diaphragm is the most important muscle for inspiration. So within the inspiration process, the diaphragm can take up to 75%. 75%. Right. Being assisted by the external intercostal muscle that we say they elevate the what? Elevate the ribs. So when the diaphragm contracts, it will it will contract towards, it will bulge into the abdomen. So you see this part, it will bulge into the abdomen. So when it bulges into the abdomen, it is going to increase the volume of the thoracic cavity. And when the volume of the thoracic cavity is increased, what happens to pressure? Pressure decreases from Charles' law, right? Gas laws, right? So what is going to happen? You're going to have, when it gets into the abdomen, it's pushing the structures of the abdomen down, the organs of the abdomen down. So thereby it will constrict these um, organs into a small space. Thereby, so what is going to happen is you're going to have an increase in intra-abdominal pressure and a decrease in intrathoracic pressure. So this one is very important. Why? Because it is going to give the function of the muscle as well. So its main function is to aid inspiration. So when the interthoracic pressure decreases, you're going to have air will start to gush in because air move from high pressure to low pressure. And then also you're going to find the diaphragm acting as a thoraco-abdominal pump due to its action, because the abdomen is now high intra-abdominal pressure and the thorax is low intrathoracic pressure. You're going to find that uh, blood in the inferior vena cava, right, it will be uh, constricted or exposed to high pressure in the abdomen. So this will propel it towards the thorax. Also, lymph vessels that are within the abdomen, they'll also be surrounded by the they will be constricted by these organs with that are within a limited space, and then it is going to propel the lymph, especially in the thoracic duct, towards the thorax. I hope it is understood. All right, so that's the action of the diaphragm. Let us now go to the nervous, to the innervation, nervous applied to the diaphragm. Right, so your diaphragm, here's your diaphragm, right? It is going to be supplied by uh, structures that appear in it. So you're going to have the right and the left phrenic nerves coming from C3 to C5. That will supply. That will be the only muscle supply, only nerve supplying the motor innervation to the diaphragm. But these nerves they also supply sensory innervation. But take note of this, they are the only nerves supplying motor innervation, but they also give sensory innervation, right? Especially to the central tendon. And then you're also going to have, remember our innervation is divided into motor and sensory. As for the motor, you only have the phrenic nerve, both the right and the left. While with the sensory, you also have the phrenic nerve, and also you have the lower six intercostal nerves. The lower six intercostal nerve, they will supply diaphragm. Take note of this. When we say lower six intercostal nerve, we are not including the subcostal nerve because it is not an intercostal nerve. It is a thoracic nerve, but not an intercostal nerve. So when we say lower six intercostal nerve, we are hinting at the nerve from T11. Very important. Right, so that's innervation. So let us now go to so the diaphragm, it is pierced by structures that will be moving to and fro, right? Some going into the thorax, some leaving the thorax, going into the abdomen. So you have three main openings. They are given a mnemonic called Voice of America. The V is for the vena cava. The O is for the esophagus. The A is for the aorta. So 1, 2, 3. Right. So what is important upon this opening is to know its level proportional to the thoracic vertebrae, as well as to understand the structures that move or pass through the space. Right. So structures that will be passing through the space, you're going to have the following. So in the vena cava opening or vena cava opening, you're going to have the inferior vena cava and the right phrenic nerve. And this vena cava opening is at the level of T8. Done. The esophageal hiatus that we said it will be formed by the sling of the right crus is going to be at the level of T10. So T8, T10, T12. So T8 here, right? So what are the structures that will be passing through? 1. You have the esophagus itself being changed from thoracic esophagus to abdominal esophagus. 3, 2, you're going to have the 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 gastric nerves, right? These are called gastric nerve, but some texts they say these are vagus nerves, right and left vagus nerve. But since they are going to form the plexus around the stomach, they will be called gastric nerves. They will no longer be vagus nerve and right and left vagus nerve. We will talk about it in the abdomen, right? And then after that, you're going to have um, you're going to have the esophageal branches, right, of the left gastric artery. You're gonna see it in the abdomen. So the left gastric artery is a branch of the celiac trunk in the abdomen, whatever level T12 papa, is gonna give some a continual branch that will also supply the esophagus, and this branch is also be within this opening, right? And then we go to the aortic hiatus. So the aortic hiatus, it is at the level of T12. Where is it found? It is found between the crus and posterior to the median arcuate. What does it transmit? Definitely it transmits the aorta, but you can use the mnemonic code ATA, ATA, in the same order, moving from the right to the left. You have A, stands for, right. So the A stands for the azygous vein, right? The T stands for the thoracic duct. Then the other A stands for the aorta. So aorta, right? So those are the structures that will be found within your inferior, that will be found in the aortic hiatus, right? Then there are also structures that will pierce the diaphragm, but they won't be forming these large openings, right? So I call them the 2S. So the first S is your splanchnic nerves, your sympathetic splanchnic nerve. They will pierce the crura right here. They will pierce the crura, right? And then you're going to have your right. So we're going to have the splanchnic nerve that will pierce the crura, right, entering the abdomen. You see it when we are talking about the abdomen. And then we are also going to have sympathetic trunks. Take note, the sympathetic trunks, they don't pierce the diaphragm, but rather they will move posterior to the medial arcuate ligament here. That's where your sympathetic trunk will be passing through. And then you're going to have an artery which is called a superior epigastric artery. We are going to talk about it when we talk about the vasculature. It's a branch of the internal thoracic artery at the level of the sixth intercostal space, and then it's going to descend, right? And then it's going to, so there's an opening between the sternal, the xiphoid part and the costal part. So it's going to get through that part that is behind the sternum, right? And then enters the abdomen. So this is a very important vessel because it's going to supply the anterior body wall from the clavicle to the umbilicus, up to the umbilicus. This is your superior epigastric artery. Right. So that's everything about your abdomen. So let us go to clinical. So the clinical that we have for the abdomen is that embryologically, like I said, that this abdomen, this diaphragm is going to be formed from four structures: the septum transversum that forms the central tendon, the pleuroperitoneal membranes, the mesentery of the esophagus, the dorsal mesentery, and the myoblast, right? So remember, embryologically there are communications between the thorax and the abdomen. Like I said, this I called your pericardio peritoneal canals. So if the diaphragm is, if one of those canals fail to close, there's going to be an opening in your diaphragm here, an opening here, whereby things that are within the abdomen, they can get into the thorax. That's what we call congenital diaphragmatic hernia. So congenital diaphragmatic hernia, you find, remember the structures in the abdomen, there's high pressure there. So you're going to find some structures, your loops of the intestines and so forth, getting into your thorax. So when they get into your thorax, especially most of the time, about 75%, it happens to the left. 90%, sorry, it happens to the left, right? The wall will be on the left than the right. So you're going to have, if this structure enters the thorax, you're going to push the heart anteriorly, and then you're going to squeeze the what? The lung, and this is called lung hypoplasia. So the lung is not going to grow very well. It's gonna be constricted by these uh, loops that he have herniated into the thorax. So yeah, so that's everything for me today. Thank you so much. Stay blessed.